marks Childhood Cancer Awareness Month. An international non-profit organization fighting blood cancer and related disorders, DKMS Africa, has launched what it terms Wall of Hope campaign aimed at paying tribute to pediatric patients. I'm now joined by the organization's communications manager, Nabiella De Beer, to tell us more about their campaign. A very good evening to you. Thank you so much for joining us. You're part of the efforts to highlight the global burden of childhood cancers, which of course can go unnoticed as perhaps there's not much education around it. Nabiella, tell us more about it.
Hi, good evening, Paul, and good evening to the viewers. Every year in South Africa, 800 to 1,000 children are diagnosed with cancer, and that doesn't take into consideration the many that go undiagnosed. So many hospitals miss sometimes the fact that a child has cancer, and a lot of them succumb to the illnesses. In 2020, 510 children succumbed to blood cancer, and that doesn't take into consideration any of the other cancers that children are diagnosed with. And so, you know, it's not an old person's illness. It is quite prevalent in our country. To be able to tell that story of children suffering from these illnesses, we looked to art because it's been proven that art has got an emotional way of connecting people to a message. And so we try to do that through the story of Tshegofatso, who was 8 years old when she passed away from leukemia, and Naledi, who was 15 years old when she also passed away from leukemia last year.
So who have you incorporated into this project?
So as mentioned, it was Tshegofatso and Naledi, and we obviously involved the parents, and then we looked out to well-known artists in the country. So we commissioned Skumbuzo, who's from the Western Cape, and he then went to Johannesburg to the Soweto Theatre to paint Tshegofatso. That happened this past week. And then the previous week, we commissioned Kev 7 in KZN to paint a wall facing the Bedaya Road interchange.
So in terms of just driving the educational message and highlighting, you know, childhood cancers, we know that when it comes to treatment, they're often not treated like adult cancers. What are some of the differences?
So with childhood cancer, what's amazing is that if you diagnose it early enough, kids don't actually have to succumb to those illnesses. But the key thing there is that early detection is so important. A lot of the blood cancers that children are diagnosed with, in many instances, the only cure for them is a stem cell donation. And what that is we look, so let me just take a step back. DKMS Africa and the work that we do is to find matching donors for people who have blood cancers and blood disorders such as leukemia. So what we then do is we spread education and awareness, and we raise funds so that we can make that possible for adults and children across the country. And so a stem cell donation is very similar to donating blood. It's where you have, once you are matched, so there's a 1 in 100,000 chance that you will be a match for a patient. So it's not like when you donate blood and there's only 4 blood groups, and you know, if you O positive and that person's O positive, you can then donate to that person. Here we're looking for someone's genetic twin. Once you are a match for a patient, it's similar to a blood donation in the fact that we will then have you come into a transplant center. We'll insert a needle into your one arm. Your blood is then drawn. It goes through an apheresis machine or stem cell separator machine. We separate the blood stem cells from the blood, and then we insert your blood back into your other arm. Right, so that's the process of donating stem cells. The problem in our country, though, is that for many of the Black, Indian, and colored patients, they are at a further disadvantage because stem cell donation comes down to genetics, and there's not enough people of color represented on the global DKMS registry. We have 11 million people registered on our registry globally. 75% of that is white people, and the rest is then people of color, and that's a mix. And so our patients really do suffer, and that's why we've had children like Naledi and Tshegofatso succumbing to the illnesses because there just wasn't a match for them.
So what sort of process is required when it comes to stem cell donation, and perhaps also what you may have uncovered in your research as you try and get clarity on why you're seeing such a small portion of black Indians and coloreds not being willing to participate?
So the process is, if you go onto our website, which is www.dkmsafrica.org, and you sign up to be a stem cell donor, you do an eligibility test first. So you need to be between the ages of 18 and 55 and in general good health. Once that eligibility test is done, we then send you what is called a swab kit. You will then take the swab kit and you will swab the inside of your mouth, and our courier then collects that. That thing gets shipped off to Germany, to our lab in Germany, and you get added onto a global database. Once you are a match for a patient, we will then call on you to do the donation, which takes 4 to 6 hours, but there are medical tests that happen before. But if you put into context the fact that you are giving up 4 to 6 hours of your time, but you're giving someone a whole tomorrow and a whole future, I think, the trade-off is quite simple to do. So that's the first part of how it then works. What we find with Black, Indian and colored potential donors is that there's not enough awareness and education in the country, and so it's really our job as DKMS Africa to spread that awareness and inform people about the importance of stem cell donation. I spoke to Tsegofatso's father the other day, and he was saying to me that before his child got sick, he didn't actually know that there's this whole thing that needs to happen, that people need stem cell donations, and people tend to think that it won't happen to them, but someone in our country is diagnosed with a blood cancer every 72 minutes, which means that eventually someone is going to be diagnosed, or you yourself is going to be affected. And so, it always seems very far away until it happens to you. And then people get more involved. But we're hoping that people can get involved before that point so that we can make a difference to the many, many people who are suffering from these illnesses.
A key factor is the lack of knowledge about the early warning signs. What are some of those symptoms?
So some of the symptoms, there's an amazing graphic on the internet, which our partner CHOC, which is the Childhood Cancer Foundation, has developed. It's called Sensilion. So there it will explain to you the key things to look at. And Sensilion stands for sight. So let me just think. Sight, eyes, lumps, unexplained changes, and then any neurological changes. So if you see that your child's sight is not the same as it used to be, or their eyes are, maybe squinted and it wasn't like that before, or there's lumps in them, or their behavior is not the same, those are things that people can look out for and then, go to the hospitals and see if there's further testing that needs to be done.
Very well. Thank you so much for speaking to us. And of course, as we look at September as the month of hope when it comes to cancer, before we wrap up, perhaps talk to us about some of the myths and misconceptions about cancer.
So a lot of people think when it comes to stem cell donation that it's this painful, scary process because they think of bone marrow, and bone marrow is a very different process to donating stem cells. So there's this fear that it's going to be painful, that it's going to be intrusive, that you're going to have to stay in the hospital. As I said, it's a 4 to 6 hour process done at a transplant center, and then that's it. You go back to life fairly quickly after that process. It's non-invasive. It doesn't cost the potential donor anything to donate stem cells. Then there are also lots of cultural myths around it. And so we work with traditional healers and religious leaders to overcome some of those barriers because people tend to go to their traditional healer or to their community leader before making a decision like that.
Very well. Thank you so much for the conversation. That was the DKMS Africa Communications Manager, Nabiella De Beer, speaking to the Child Victims of Blood Cancer, Childhood Cancer Awareness Month in the month of September.